Welcome to another edition of the Dementia Care Partner Talk Show. Now, here's dementia care expert Teepa and your host, Greg Phelps.
Hello and welcome to the Dementia Care Partners podcast featuring dementia care and education specialist Teepa. I'm your host, Greg Phelps, and Teepa, one of our lovely co-workers, and I won't mention Valerie by name, has been busy compiling a list of topics based on suggestions and inquiries. And at last count, I think she was up around 150 questions, so we're probably not going to get to them all today. If we don't get to yours, please know that it is somewhere in the pile. And our subject for today is do people know enough about dementia, brain change, and Alzheimer's? In other words, are we as a society talking enough about this? Because it's kind of an invisible tidal wave.
Yeah. Honest, simple answer, absolutely not. There's an intense problem with recognizing changes that are happening as to whether or not they're part of normal aging, part of a phenomena that is not quite typical or normal, but isn't dementia, recognizing things that might be fixable or modifiable in a major way compared to things that truly are in the category of once it starts, we're currently not able to stop it. So let's keep it from progressing as much as we can, or maybe let's start working on how we're going to support somebody with those shifts. And honestly, I mean, there's so little awareness in so many places and spaces, from medical providers through social providers, through legal providers, through families, through communities, through healthcare systems, that I think it's a huge issue because we just aren't prepared for it. And we keep lumping people together that don't belong together. And we keep using words like Alzheimer's when we don't know what exactly is causing the brain changes that we're talking about. And we may, in fact, be grouping it in a really unhelpful way.
Now, there were lots of warnings about this tidal wave. You know, we used to talk about that prior to COVID. We can talk about that in a minute.
We called it a tsunami, not even
Tsunami, yes. But
tsunami.
did we actually prepare for it, or did COVID derail any progress that we had sort of been making in getting this to the forefront? All of a sudden, maybe we were kicked to the back pages.
Well, I think COVID certainly took over, and the quote unquote public health crisis ignored a big chunk of public, which was people who were living with the brain changes already that hadn't been recognized. And then we socially isolate them and physically isolate them and put families in stressful situations for long periods of time. And then we come out from COVID and it's like, oh my, we have a whole group of people we shouldn't have had yet added to the mix. So I think not only did COVID put, in general, what I'd say, dementia on the back burner, it ignored dementia, totally ignored it. And I'm being brutally honest, totally ignored people living with dementia in their public health messaging. And no recognition that staying 6 feet away from a human being when they need your physical assistance is illogical and irrational. Keeping human beings who are placed in locations for social engagement as part of the placement, and then keeping them in small spaces away from one another, and yet having the workers go from person to person in the same outfits really was not only not helpful, it was totally illogical and not in the public health interest of those individuals, given their situation. It's just, I'm still dumbfounded. So it's still, we are not only ignored, we actually are further behind than we were because of what was done with people living with dementia and their care partners for 3 years.
So seniors are being victimized sort of again. And I'm saying it like that because that's how I feel. I think that we're short shrift all the time.
Yeah. I mean, the decisions that are made for people is like, well, we want to keep you safe. And it's like, what's my due date? I mean, you know, it's like keeping me safe when I can't see anyone, can't
For
interact.
what?
And I can't take care of my own my needs. That's why I'm in the situation I'm in. And we're going to keep me isolated for my safety. And it's like, I think we've just gone off on this edge where we didn't think through, because we have communities that said, yeah, we're not going to do it exactly that way because these folks need to be in community. Now we're going to be super careful with ourselves going in and out of that community because we're the highest risk vector. And we're going to keep them in community. And what we find is those situations, those folks have really not shown the plummet, not shown the loss, not shown the changes that many people living with and their families did show. And that's not to say everybody who lived with dementia plummeted during the COVID crisis. Some folks found ways to negotiate internet connections that kept them well. I mean, but that was not due to any governmental support of doing so. It was innovation and, just we got to do something kind of thing.
Is there a little ageism sort of in the background here, do you think? Because we're no longer viewed as contributing members of society, that we're in care, we're locked away.
Yeah, I think, well, not only is there ageism, I'm going to be honest, talking to the other gender, there's sexism, where majority of the workforce and a majority of people we're talking about are going to be female. That's the nature of aging. Males die before females. And so we have more older women than we have older men. So if you make older women, and women in healthcare historically have been ignored more and diminished and disregarded in their healthcare requests and healthcare perceptions, by a system that is biased. And a lot of the research from 25, 30 years ago didn't even include women. I mean, men were the primary subjects of research. Now we have the same issue with gender and racial and cultural inequalities, because we have a variety of this sort of disregard for humans and where they live and how they live and what the risk factors then are. So socioeconomically, the workers who are at highest risk were staying on the job, and people who were managing those workers were often not staying locally and involved. So, I mean, there was so much going on there, Greg, and I think it's still present. That filling hospital beds in Canada, for instance, with people who belong more accurately in a support environment, a community environment, where they are going to live, not like in a hospital where they're sick. They aren't sick. They're just needing support and care, and the beds availabilities are still not there. And so hospital stays, as I understand it, both in the US and Canada, we're struggling with how do we keep people out of hospital. And the problem is we've got systems that haven't fully recovered, either in personnel or services, quite honestly, to meet the need.
So how do we start getting this thing back on track? Because we had a fair amount of momentum, and then along came COVID. So how, we had politicians who were listening. There was actual, work being done, progress being made. How do we get back on track?
Well, in the States, we'll probably have to get through the 2024 election. Honestly, we can do it, because this is not going to be a centerpiece in anybody's election campaign. Unfortunately, there was a period of time when it might have been, as was Social Security and that kind of support for this, and Medicare reform. But it's off the burner. And now we're talking, just as in Canada, we're talking about inflation and jobs and job creation and the economy and
Climate change.
And so we've backburnered it yet again. And so people are just drowning. Families are drowning in the need for support. And it doesn't feel or seem to me that we have a cohesive anything other than, well, people want to age in place. Good to know. How shall we do that? Because that's not going to be an automatic pattern, and we don't have the support structure for it now. It's sort of, Greg, do you remember when they closed the state and your regional mental health facilities, where they had the secured units and everything mental health wise, the big psych hospitals, and they closed them down, saying it was better for people to live in community. And they were going to get these community service centers set up and all that help out there. And we closed the facilities, and then people became homeless, and chronic mental health issues emerged that still to this day are everywhere.
And that's worked out really well, hasn't it? Yeah.
Really well. And my fear, we're set up to repeat it again. Yeah. I don't think we've done anything different to make it different.
Teepa, you said sometimes people feel like they're drowning. Have you got any lifeguards that people can reach out to?
Yeah, I mean, we're doing what we can, and it is a small effort, and I know that in a sea, but we are working hard to keep free services, consults. We also have very low cost training. We are trying to build a center here in North Carolina where if people are curious how you could do this in a real community, not built, made up town, but a real town where people are living and working, and having a place for folks living with to be part of that community. We're working hard to try to get that in place as quickly as we can so that it can serve as a model. And I know that there are other communities out there that are similarly engaged. My goal, hopefully, is that we will start connecting these communities together so that we can have real conversations. But if you're stuck, we'll do what we can to support until we get somewhere better, because we feel it too.
Teepa, thank you very much.
Thank you, Greg.
You've been listening to the Dementia Care Partners podcast, brought to you by Positive Approach to Care. For more information or to ask your questions, contact Positive Approach to Care at teepasnow.com. If you're signed into your Spotify account, we'd love to get your feedback. How? Click into the episode details and look over the episode question and poll. Send us your comments and vote so we can answer your questions and better tailor this content to your needs. We look forward to hearing from you.
Hi, I'm Teepa Snow, and you just found our YouTube channel and watched one of our videos. I'm the owner and founder of Positive Approach to Care. Thanks for watching, and if you liked, if you have a comment about, or you would, please share it with people you know. Oh, and if you haven't yet done it, consider subscribing. We'll let you know when the next new video comes out, and you might want to visit our website, www.teepasnow.com, where you'll find other resources as well. See you there.